question I'd like to pose to you today is simply this. Are patients the greatest underutilized resource in healthcare? And if so, what role could technology play for patients, and what role has it played? And in a world where we are dominated by so many technology companies getting involved in healthcare, getting involved in our everyday lives, I was struck by a quote at one of these conferences that I saw earlier. And it said, "We've now reached the tipping point where computers will relieve the burden on clinicians to provide more time for patient care." And it was a pretty bland, pretty innocuous comment, something nobody would ever think much about. But what struck me about that quote was very simply, it was actually a quote from 1984 by the Secretary of State for Business, the then Kenneth Baker. And if we wind the clock forward 34 years, I think we'll all agree most of our lives have changed dramatically with technology, but I wonder how much has changed in the role of the patient. Because I suspect so many of you in the audience today bank online, shop online, buy your travel online, consume most things you do online today. But I wonder in the role of healthcare, how many of you email with patients, text, use social media, video conferences, use everyday tools that we take for granted when interacting with patients. And I think before we start to look at the greatest underutilized resources in healthcare, we might need to focus on three things which I'd like to touch on today. I'd like to talk about bravery, I'd like to talk about courage, and I'd like to talk about relationships. Because I would argue that the greatest challenge that the system faces to deliver a more engaged healthcare is whether it's prepared for cultural change, and whether that cultural change will allow you and empower you to work with people like me in a brave, courageous, and build relationships together. Now, you will hear, and you have heard, many patient stories today, and none of ours are any more important than the other. But I get a few minutes to share with you a bit of my patient journey. On the 8th of October 2011, at 6:01 a.m., I kissed goodbye to my loved one and didn't know if I'd see her again. 15 hours later, I woke in the intensive care unit at the Churchill Hospital in Oxford, having become their 11th intestinal transplant patient. And my journey to that point started at age 12, when I was diagnosed with the incurable bowel condition, Crohn's disease. I had my first surgery at 14, and 25 further surgeries later, I was at the point of intestinal failure. I was left with 40 centimetres of a small bowel, and most of it stuck to my pelvis. But throughout that journey, it wasn't really my medical condition that defined my life. It was a series of relationships that actually started as a 14-year-old boy when my parents took me to see one of the most eminent gastroenterologists. And let's be honest, every parent believes they know the most eminent physician, and mine were no different. And I went to see a gentleman by the name of Anthony Dawson, a gastroenterologist out of Bart's Hospital. And he went on to become the Queen's physician, Sir Anthony Dawson. So I guess they felt if he could scope the Queen, he could scope me, and that was fine. But he said to me something very, very important as a 14-year-old. He said, "Here's the deal, Michael," as he peered over those glasses in a scary voice. He said, "I'm only going to treat you if you take as much care and responsibility for your health as I do. I'm going to teach you what it's like to have Crohn's disease and how you need to react and how you need to look at your markers. And you're going to teach me what it's like to be you. And we're going to be a team, and we're going to be a partnership together." Because you see, fundamentally, healthcare isn't about technology. Perhaps it isn't even about bravery and courage. It's about relationships. That, fundamentally, for me, is what's lived throughout my journey. And as I wound the clock forward to going through my intestinal transplant, I'd been lying at University College Hospital in London for 18 months. I'd had further surgeries to try and kickstart the bowel, and I was told I needed this transplant. And I was told, you don't want to have it in the UK, because they'd only done 10, and 5 sadly hadn't survived. So I went off to New York for a second opinion, and they said to me, you need a bowel transplant, and if you wait a year, you're going to need a liver and a bowel, and those odds of survival are worse. So I did what, according to the Pew Institute in America, 86% of us do. I turned to the busiest doctor in the world, Google, to find out about a gentleman called Anil Vaidya, who was about to restart the intestinal transplant program in Oxford, and there was nothing about him. So I rocked up with my wife to Oxford, and we went into a typical waiting room that you're all very familiar with, desk with 3 legs, 3 chairs and 8 people, and 8 lever arch files on the side of the table. And in rocked Daniel. And I remember it to this day very, very clearly, because he was wearing the worst fitting Ralph Lauren jeans you could ever imagine, and flapping around his ankles with these great bright red socks. And it was like, okay, what have I let myself in for? But he did something very, very special. He didn't actually open a single file. He took the notepad off the top and he drew what my intestine looked like with it attached to my bowel. And then next to it, he drew a series of pictures of what my intestine should look like and what my operation would be like going through the procedure. And in the space of 2 minutes, we built a relationship. I was back to being that 14-year-old boy again. And he said, we're a team, and we only get through this together if we work together. And life as a patient today, as you can see, is very, very different for me several years on. I have the privilege of standing on stages like this. But how I consume my health has actually also changed quite dramatically, because at the heart of my life is obviously the National Health Service, which saved my life and continues to save my life. I'm now treated in the US as well, so I get the joys of sharing and comparing between the US and the UK. And obviously my family and everything play a big role in it, but also my online community. Because one of the most important things about how I interact with my health is the ability to connect with another patient. That ability to have one-to-one interaction with another patient. And just as important as that is my social media engagement, the ability to go online, talk and share information. And I stand here before you today still with a central line that I inject 3 times a day. And if I want to know how to deal with an aseptic technique when the duvet is falling off the bed and the dog's running around, it's not actually my nurse I can talk to, it's another patient who's experienced the same thing. And that's the healthcare journey that I think patients are on in 2018. And in the build up to my transplant, I started blogging. And really, it was just a way of helping friends and family know what I was going through and to save my wife from lots of phone calls. But I then discovered that my transplant surgeon was reading my posts. And he was then sharing it with his medical students because he wanted them to know what I was feeling in the build up to transplant. And suddenly 100,000 people were reading this blog from this bloke in Hertfordshire who was about to go through a scary surgery. And after transplant, he's like, you're always on social media. What are you doing? Connect me. And so I connected him. And I said to him one day, as I was leaving the hospital, I said, you've got my blood results. Can you do me a favor? Send me a direct message with my blood results. And for those of you who don't know, a direct message is on Twitter. It's like a text message. It's a private one-to-one message. And I'd said, I consent, just send me them. He tweeted the world my blood results. And I can imagine the intake of breath from the trust was just enormous. But actually what happened then was that 4 doctors from around the world tweeted back and said, actually, based on those results, I think you should do this test, and this test. And actually, isn't that the way of the world today? And that wasn't down to me. That wasn't down to my courage. That wasn't down to my bravery. That was down to his bravery. Because actually, is the system going to empower change to allow all of you to be brave enough to engage with pain in the arse patients like me who want to engage in a different way? And when he was on the end of my bed and he was examining a biopsy to see whether I had acute rejection, and he didn't know, and I was number 11, there wasn't a lot to go back. He opened his laptop and he started doing a video conference with doctors around the world, 3 of his friends in Miami and Washington, another one in Chennai, and they're poring over my biopsy. Because that's the way healthcare is going to be consumed in the future. That's how I live my life. Why isn't that the way healthcare would be done? And it starts with the bravery of the healthcare professional. Because as patients, we can't wait for a system to change. We don't have time. Patients like myself live with 50-50 survival rates every single day. And some of you may well be aware that there are growing movements of patients trying to make a difference in their lives. There's a hashtag online called We Are Not Waiting, built by patients who are trying to hack their own health. There's a maker movement, which is again about patients trying to solve their own problems. And when I was lying in hospital after my transplant, I had a stoma. For those of you who don't know, it's a bag attached to your body and you go to the toilet in a bag. It's not the greatest experience. So I was lucky enough. I bought some parts online, used a video and hacked together a sensor and proudly walked up and down the ward with this sensor beeping to show me that my bag was filling. And my doctors would say, that's fine for you, but I still need to know how much is coming out and when. And we built an algorithm to give real-time data that's now a care management program and platform for all patients connected to bags. But when I wanted to raise money for that in the UK to try and grow the system, I was turned down 43 times here. Not because there isn't any brilliance and there isn't any vision and there isn't technology here. Two reasons. One, you're a patient. How would you navigate the system? And two, you're a patient who's likely to die before your product comes out. So I'm not backing you. It was a bit different in Silicon Valley. And sadly, I spend most of my life in Southern California, although the weather's pretty good. But if you want to know who invented the first artificial pancreas, it was a patient in America who's now working with the largest diabetes companies to solve that. If you want to know who invented the quantified self movement, which is all about tracking symptoms and everything through technology, it was a Parkinson's disease patient in Scandinavia, all of whom had to do these things because they couldn't wait for change to happen. They had to live their lives like me every single day. So patients can play a role in healthcare. And particularly in 2018, as we move to a life around personalised medicine, as around value-based care and outcomes-based care, and we move away from fee-for-services to what outcomes matter. How on earth could anybody know what outcomes matter without talking to that end person? Because each one of you has a different outcome that's important to you. And I inject medications and I hook myself up to lines on a regular basis. But actually, there are times in my life when I want to go and be at the concert to listen to my 18-year-old sing, or I want to go and see my eldest son graduate. I want to go out and see my grandparents. And actually, they take priority over that injection or that timeline. And unless we work together, nobody's going to know what outcomes are important to each other. And how can you possibly deliver personalised medicine if you don't know what's important to the person? So I would say this. We always look at other technologies and other industries to try and learn from and build solutions. But actually, it's only really in healthcare where we build solutions and deliver them to an end user. In automating cars, in looking at online social media platforms, in looking at our shopping patterns now today, everything is built and developed from the end user up. Now, I'm never going to be a surgeon. I'm never going to be a clinical researcher. I'm never going to be a nurse or a phlebotomist or anything like that. But I have a contribution to make in healthcare. And I don't necessarily think patients are the greatest underutilized resource. I think it takes us all to come together, and that's the greatest strength in healthcare. That's the real power. It takes bravery of a system to empower you to want to engage with people like me, because it's together that we make those changes. And what are the barriers to some of that? Well, I suspect most of you are going, well, it's data. You can't share data. You can't share things. Actually, most patients are sharing more data on social media today than they do with their own healthcare professionals. And we get blinded by a vocal minority and a big headline about data sharing. There is nothing I wouldn't share with anybody if it gave me a chance to be at another concert for my daughter, or another milestone in my kid's journey, or another event with my family. Nothing I wouldn't share. So let's not use things like that as a barrier for change. It falls back to that culture. Are we brave enough and are we courageous enough to allow our systems to work with amazing people like yourself and pain in the necks like me to make those changes? Because when we look at the current model, and we have chief executives, we have chief nurses, chief surgeons, chief executive officers, CIOs, we don't actually have any chief patient officers. Yes, okay, we have patient participation and we have committees and we have tick boxes, but actually, why don't we co-design and co-develop things together? Why is the end user not part of that? I had the privilege last year to be a patient in residence at Stanford in the States. And we built a model of care called Everyone Included. And it basically meant that you don't deliver any solution in healthcare without everybody that's affected by it co-designing and co-developing it together. And we changed the way clinical trials in the US were going to be done. We sat at the White House and made policy changes that said you only design clinical trials now with the end user as part of that collective together. So my challenge today is very simply this. Will the system empower all of you to be brave enough to change the culture and make a difference? Because actually, there's no one single person that is really an underutilized resource. Change in healthcare will only happen if we work together. And I think in 2018, it's time to make that change. Thank you very much.